50 years ago, doctors at Mayo Clinic in Rochester, Minnesota opened the doors to modern open-heart surgery using the heart-lung machine. Back then, you had about a 50-50 chance of making it off the table. Now you can be 98% certain that you'll survive. But doctors at Mayo Clinic say that's not good enough. They're using methods developed by the aeronautics industry to make surgery even safer. Air travel is very complex but very safe. A main reason for this high level of safety is the time and research the industry put into designing technology that's user-friendly. For example, everything the pilot needs is at his or her fingertips, and he or she can communicate with the crew at any time. This design makes it less likely for the pilot to make errors. Such highly tuned orchestration grew out of an aeronautics discipline called human factors.
They developed approaches to dealing with the complexity of the aircraft, like checklists, to help the human cope with this very complex machinery.
And that's what surgeon Thorolf Sant hopes to do in the operating room.
What human factors brings to us in the operating room is trying to understand how to prevent errors in medicine. If an error occurs, how to capture it quickly before any harm is done.
Dr. Sant is teaming up with quality care expert Sarah Henriksen on a study to see if observing what happens in the OR can help them understand how to make the process better and safer. You can see how the camera used in the study may have caught an area where communication could have been improved between the surgeon and the perfusionist. He or she is the person who runs the heart-lung machine, which is a very complex piece of equipment.
So I may give a command here. I'm actually faced away from the perfusionist. They can't see my mouth, they can't read my lips, and I'm talking down into the wound.
So perhaps rearranging where people stand could improve communication.
And we think that there's a lot that we can learn by watching how the team functions.
Making surgery safer for those who put their lives in their medical team's hands. Dr. Sant says some of the other issues that he noticed from observing how his operating room functions include distractions caused by beepers going off and people walking into the room. He hopes to use the information from the study to make operating rooms safer and more efficient. He also says that by encouraging other members of the surgical team, such as nurses and technicians, to speak up if any issues arise will add safety in the OR. For Medical Edge, I'm Vivian Williams.